just to bring it back full circle, I think the Treasury Board officials again suggested that there could be as much as $40 million in as yet unidentified savings. You know, certainly there's always a lot of concern when numbers like that appear that it's going to involve the elimination of positions. That wasn't part of the budget announcement, but it still seems to be really difficult to do it in this period of time without, even if it doesn't require an actual layoff, eliminating a position. And it just, I guess there's a lot of people like myself who just believe that you guys are maybe holding back some of the bad news until later in the year when people will be looking forward to the progress or looking at the progress you've made in reducing the deficit.
Nope.
So no additional layoffs, no additional position eliminations at the RHAs as a result of the merger and or any other of the austerity measures, the efficiency searches that your department's undertaking?
Every government department, health being no exception, is being asked to try to find new ways of doing what we've always been doing. Right. And in fact, if it's possible, find a better way to do it that could cost us less. Right. You know, your paper ran a feature on the weekend about something called virtual wards, where what's old is new again, and we're working to ensure that we're bringing doctors and nurses into people's homes right. whenever we can to perhaps avoid that journey to a personal care home. So we are going to be innovating all the way through with a focus on the patient. As far as some of these backroom functions that you're talking about, I believe that in instituting those innovations, we're going to need people to help manage them. Right. So will people be doing exactly the same function, the same procurement function, for example, when we find ways to bulk buy? No, they might be doing something else that's about the healthcare of today. Right. And let's be absolutely clear. Are we holding back the bad news? In actual fact, I think we're coming forward with the good news, that despite the economic uncertainty, when other governments are making decisions to hold back, we've pushed forward on free oral cancer drugs. We're pushing forward on an online organ donation registry because these things matter to people. So respectfully submitted to what I might define as a glass half empty attitude, Mr. Lett, right. We're actually glass half full. Okay. And we're pushing forward. It's going to be a lot of work, but the people of Manitoba are counting on us to do the things we said we'd do. Free cancer drugs, family doctor for all, more home care, more long-term care. That's what we're going to do.